folks to receive vaccine. It will take more than just us and the hospitals to reach the majority of our community. And we are thankful to the groups that we're working with who are making vaccination plans to begin this process. We will continue our role as convener to bring as many folks to the table as possible in order to increase access for the community. Additionally, we are actively coordinating with hospitals and other partners to share vaccines that we are receiving for them to be able to distribute that vaccine as well. This week, we are providing more than 2,000 first doses to qualified individuals. Those appointments were posted last week for yesterday, today, and tomorrow, and filled up very quickly. We are also providing second dose vaccines this week to those who received their first dose with Kchd at the beginning of January. Later this week, we expect to receive more vaccine and will make additional opportunities available as we can. As mentioned last week, we plan to launch a new automated scheduling system and registration platform that will, with a wait list as an option. When this system is launched, those who are 70 and older, as well as other qualifying groups, will be able to register for appointments and sign up on the wait list. More information on this new online system will be available soon. For the weekly vaccination update, we will go through some updated data on our vaccination information webpage. We will be updating the data on this page every Tuesday and Friday. On this page, you can see that nearly 45,000 vaccinations have been given in Knox County. Here at the Knox County Health Department, we've administered nearly 9,500 vaccinations. We want to stress the significance of that 45,000 people in Knox County considered high risk or vulnerable to this virus have received this much needed protection. To date, Knox County has received approximately 15,000 doses of vaccine, but it's important to note that some of those doses that haven't been administered yet are specifically allocated for second doses. Additionally, as we've mentioned, we are also providing some of the vaccine we're receiving to other partner organizations for them to administer because more distribution points will help increase access. Now we'll move on to the local situation.
Can we pause real quick, Dr. Buchanan? We had an issue with what was showing on the website, and let us show the accurate information real quick. Sorry.
No problem. I was wondering what was going on.
So now the current information, we had not refreshed our website. So the current information is on there and available for folks to be able to see.
Okay, thank you. All right, I'm gonna move on. Okay, now to move on to the local situation. We have 60 new confirmed cases since yesterday's report. We have 2,563 active cases. 83 Knox County residents are currently hospitalized.
Sadly, I'm having some technical difficulties. Just give us 1 second.
Okay. Are we good? Do I need to start over? What do you want me to do? Okay.
You are good. Please proceed.
Sadly, we have 2 additional deaths to report today, bringing our total to 485. And now we'll open it up for questions.
All right, if any members of the media have any media questions, please go ahead and submit those into the chat feature. All right, with Allie from KnoxNews, what changed that made you confident to add another age group? What role do supply and points of distribution play in that decision?
So our decision to add the 70 and older age group was strictly based on the fact that the state added that and moved forward in the 89 counties that are not metropolitan counties. And in order to avoid confusion for our citizens and their citizens, and even our team, we wanted some consistency there. So we're staying in step with the state there. It doesn't increase our supply. It doesn't give us more vaccine. It just makes more people eligible for vaccine. We're happy for that. You'd have to ask them why they made that decision to move, but we really felt like it just added to the confusion to have those 2 different categories.
All right, Grace with WBIR. Did the state tell you before they made their announcement of moving to 70 plus, or was it a surprise?
They told us, we were notified, I believe, yesterday that they were going to make the announcement before they made the announcement.
All right, Allie again with Knox News. Are you concerned that adding about 20,000 more people to eligibility will cause more frustration among those who can't get an appointment?
Yes, I am, of course. But again, it really helps with the confusion and clarity for the population, not just in Knox County, but across the state. People are going to different counties to get vaccinated. People are going where they can to get vaccinated. And we wanted to keep that consistent across county borders.
And a second point to Allie's question is, how do we plan to address that?
We'll continue to make appointments available as we can and as we get vaccine.
All right, Grace with WBIR. Every week we've heard about this new sign-up system. Any estimated timeline for that?
You know, it's a complicated process. We had to follow, of course, county contracting process, and we did that, and that's completed. And now they're literally building the system for us, and that takes a lot of time. And we want to make sure that when we launch this, that it works well, it's easy for people to use, easy for people to access. So we're being very cautious. County IT is working, and our staff are working every day on this project, as well as the company that we're contracting with. So we're hopeful that it'll be out soon. I don't have a definite date because we want to try it out and work out any kinks or challenges that we might have before we go public with it.
Great, Jeff from WATE. Once the wait list rolls out, will people be able to call and get on that list in the way that they would be able to sign up online?
Yes, we plan on keeping the call-in and the online versions available, because we know that some people maybe just can't navigate it or don't have access, so they can call in. The call-in number may change for that, but right now we'll still have call-in option and an online option.
Grace with WBR has asked, you are asking for volunteers to help with vaccines on social media. What are those volunteers going to be doing, and how many people are you looking for?
We don't have a set number of people that we're looking for. Supplementing our staff with volunteers allows our staff to really use their expertise to manage and run the clinic. And so we're looking for people who are qualified to get vaccine. We're looking for people to help people register, help tell people, go here next. All of those things, people to watch when people have been vaccinated and they're waiting, people to work in the parking lot to help people know where to park. So like any big event, a vaccination event takes a lot of people to pull it off. Sorry. Yeah, so we're looking for both clinical and non-clinical folks to support the effort. It's really like, it's not like it is putting on a large event that goes on all day where you're serving the public and people are waiting in line. So it takes a lot of people to help make that happen and run smoothly. And I've been really proud of the volunteers and our team as they've adjusted and kept things going and made sure the flow, each day we try to improve how things go and the throughput. And we've gotten a lot of really positive feedback, well-deserved positive feedback for the work that we're doing and how smoothly it goes once you get there.
Another question from WBR. If the contracts are signed, I'm assuming, Grace, that you're referring to the registration platform, but if the contracts are signed, are you able to tell us what platform it'll be on?
I can tell you what the company is. If you want to see the contract, you can certainly make an open records request for that. I think the company's name is Luminaire. So that's what I know about the company.
All right, Allie with Knox News. How many people 75 and older in Knox County have been vaccinated as of today? And Allie, I think we'll have to follow up with you, but we can get that figure for you.
Yes.
A second question from Allie with Knox News. Vaccinating older residents presents its own unique challenges, especially when it comes to technological ability. What has KCHD learned about servicing elderly populations during the pandemic?
Well, I tell you what we've learned is they're not as technologically challenged as we might believe. Lots of folks still call in and we're able to walk them through that process. But what we've also learned is that, for instance, if I needed to register my father who's older, he lives in assisted living, I'd do it for him. And we see that over and over again, that daughters and sons and nieces, nephews, and grandchildren are helping grandma get registered and grandpa get registered so they can get vaccinated. But we, of course, use the phone system as well. One of the things we did change is we held some appointments back for the people who called in because that takes a little bit longer. So, you know, people have really accessed our system very well. We've also partnered with some community agencies such as CAC to do what we call slow flow clinics. So these are clinics that don't have as many people. They're being held at smaller venues, and those folks who take a little more time to get registered and go through are going to those clinics. So we're specifically working and targeting populations that we know have limitations.
Jeff from WATE has asked, can you offer any guidance for people getting the vaccine when it comes to continuing to follow the 5 core actions and so forth?
Well, the guidance is you still need to follow the 5 core actions. That's about it. So yeah, right now the guidance continues to be that regardless of your vaccine status, you need to follow the 5 core actions: social distancing, wearing a mask when you're outside your household, washing your hands regularly, staying home if you're sick, and cleaning surfaces. And now we'd add a 6, get vaccinated when you can. So the reason for that is that we know this vaccine is a very effective vaccine, but it's not 100%. And so those folks who've been vaccinated could potentially get mild disease and unknowingly pass it on to someone who hasn't been vaccinated. And this is not the time for any of us to slow down on the 5 core actions. Our numbers are trending down, our hospitalizations are trending down. Those are all very encouraging, but we cannot stop being diligent about the 5 core actions at this time, or those numbers are going to go back up. It's that simple.
Great. Jeff, I think that answered most of your question, but he did include, you know, how long should they do that as part of that question?
Right now, the guidance has not changed from the CDC, and we'll wait new guidance from the CDC. They'll need to have enough evidence to be able to say people can change their behaviors.
All right, from Alan Sims with Inside of Knoxville, people undergoing cancer treatment seem to have been removed from group 1C. Why?
I'd have to look at that, but I'm not aware of that change happening. But again, we'd have to look, and then if it really did happen, ask the state.
All right, from Grace at WBIR. Once you receive vaccines from the state, how do you determine whether to give doses to other medical providers in the community? And then she has a couple other questions there. How many different partners, and can you elaborate more on that process?
Okay, so basically it's kind of a group planning process. So there are 2 different ways a partner might get vaccines. So the county gets an allotment from the state, and that allotment is for all of the providers, hospitals, health departments, and others who've been activated by the state to give vaccine. So they place orders, and then late in the week, we get an email from the state saying this is Knox County's allotment. Here's who's ordered what. And then it's a series of phone calls and conversations to say, Knox County Health Department has this plan. We can do this. Could you use this many doses, or do you need what you've ordered? What do you have planned? So it's kind of a complicated process. We're working on adding some people to that team. We look at what people are planning to do with the vaccine and what they can think they can reasonably give over a week. And again, we look at how people are allowing for access to the priority groups and how they're going to allow for that. And all of our partners are doing that. All of our partners are following the phases. They're allowing access to those priority groups. And it's not just one day, it's ongoing. Some of our partners are helping us get the 1A2 folks vaccinated. So all during the week, they're getting information from our team about the 1A2 groups that still need to be vaccinated. So it's a multifaceted process that we believe is increasing access and making it pretty easy. We're getting really good feedback from our partners about how pleased people are how things go when they go get vaccinated there. So I'm excited about how it's going. Would I wish that we had more vaccine? Yes, I wish we had more vaccine.
All right, Jeff from WATE. Does the 70+ eligibility apply to other vaccine sources like hospitals?
Yes, all of the partners that are participating with giving vaccine in Knox County, it's one of the requirements to participate. They have to agree to follow the state's guidelines.
Allie with Knox News. Can you clarify why KCHD wouldn't get more vaccine if the state is expecting increased allocations?
I don't know that the state is expecting increased allocations. If they are, our allocations have increased over time. So I've seen that happen. So I'm not aware of. So the kind of process is the state gets notified by the federal government Wednesday or Thursday about the state's allocation, and the state looks across the state to determine, but based on population and probably some other factors. It's also based not just on the total population, but the population in the risk groups and socioeconomic status and some other things. So the state does that, and then they allocate. Our allocation has gone up a couple of times. So it seems like as the state, if the state's getting more, we are getting more vaccine.
All right, Jeff from WATE. Once a person is added to the wait list, will they be sorted by priority based on some criteria, or is it something like first listed, first served?
So two things. One is they will have to fill out basically a registration form that, and part of that is asking them if they fall into one of those priority groups. So you can't get on the wait list if you don't qualify for the vaccine. So that simplifies that piece. It happens before they even get on the wait list. So once they get on the wait list, they'll be prioritized just based on who's on there first. And they'll be notified in a couple of different ways, depending on how they notified us. If they went electronically, we'll electronically notify them. If it was a phone call, we'll have to have somebody call them. So again, it's mostly automated, but not completely automated. There will probably be some phone calls as well for those folks who did call in and register.
All right, and from Jeff, the second part of that is how are the actual appointment times and dates allocated?
So appointment times and dates are allocated based on when we have vaccine. And the other thing, so for instance, I believe it's this week, Friday and Saturday, I think this week, we're doing 2 second dose vaccine clinics that will vaccinate more than probably about 2,000 people for their second doses. So we have to coordinate between second doses and first doses and how much vaccine we have available. I mean, it's very complicated. We actually schedule a full day, and they're blocked off in time slots of 15 or 30 minutes. And our team knows how many they can do in 15 or 30 minutes, and we allow for that many to be put in there. We change it up a little bit for lunches so people can take a break and go to lunch. So it's a pretty well-oiled machine once we get people loaded in there and we know we have vaccine.
And to that end too, we have multiple vaccinators working at the same time to expedite that as well. Allie from Knox News, once the wait list is up, will it be the only way to get appointments?
You know, that's a great question, but probably yes, because we anticipate once the wait list is up, it'll fill up with a lot of names, and those names will roll over into appointments as they're available.
All right, and the second part of her question is, will 20% of appointments be reserved for callers?
We haven't made that decision yet.
Okay. David from WVLT has asked, how much vaccine is KCHD receiving this week?
The allotment for so KCHD is getting 1,950 doses. Sorry, I had to reach back and remember things. The allotment for the county this week was more than 5,000 doses, and those are split among partners. It was 5,300 doses. So those are split among hospitals and other providers who are working and partnering with us to provide vaccine.
All right, Grace with WBR, what options will there be for people without internet access?
They'll be able to call in.
Not seeing any more questions, so if the media has any more questions, please go ahead and submit those into the chat feature. All right, not seeing any more for today. We thank you very much for your time, and we'll see you on Thursday. Have a good week.